Hello and welcome to GP Notebook TV. My name is Anish Kotecha and I'm a GP in South Wales. Today I thought I'd discuss with you the recent Public Health England information and guidance that came through regarding myocarditis and pericarditis following COVID-19 vaccination. This is relatively hot off the press, came out in August 2021. So as usual, I'm going to give you some quick updates and take-home messages that I feel are relevant and important for us in general practice. So really, just to jog our memories first, we all know that myocarditis and pericarditis are inflammatory conditions of the heart that can be caused by viral infections. Now, myocarditis typically tends to affect men in the younger sort of age group. And typical symptoms are things like chest pain, shortness of breath, palpitations and fatigue. Now, although this can cause dilated cardiomyopathy, chronic heart failure, and actually this condition is implicated in about 12% of sudden deaths in adults below the age of 40, many patients actually have recover quite quickly and have very sort of mild symptoms, and the prognosis is actually very good. Pericarditis presents in a very similar fashion, and again the mainstay of treatment for this is the use of non-steroidal anti-inflammatory drugs. Now, although the prognosis is good, some people can actually suffer from recurrent attacks, but again prognosis is good. Now, we all know by now that acute COVID-19 infection can affect cardiac muscle, and there are reported cases of myocarditis following acute COVID-19 infection. Now, in the United Kingdom, there is evidence to show that there are cases of myocarditis and pericarditis following COVID-19 vaccination with all the common vaccines that we use. And therefore, the advice is that if patients develop the typical symptoms of these conditions within 2 weeks of a vaccine, they should seek urgent medical attention. But just to clarify for us, that symptoms are usually mild and fairly self-limiting with medication. Now, just some advice for our patients: that if patients have had myocarditis or pericarditis previously unrelated to the vaccine, then this is not a contraindication to receiving the vaccine, but our patients should be counselled about the benefits and risks of the vaccine and to help them make an informed decision. The other important thing and interesting thing is that if people have had myocarditis or pericarditis following the first vaccine, actually the advice at the moment is that the second dose of the vaccine should actually be deferred until further advice is sought. And just a reminder to us all that really, if we're suspecting myocarditis or pericarditis following the COVID-19 vaccine, then we should be reporting these cases to the MHRA using the usual yellow card scheme that we're all probably very familiar with. So really, in summary, there are reported cases of myocarditis and pericarditis following COVID-19 vaccination, but symptoms are usually fairly mild and tend to get better with treatment, and the prognosis is usually quite good. And we should be advising our patients that if they do have typical symptoms of these conditions within 2 weeks, then they should be seeking medical attention. I hope you found this short, sharp video useful, and please do continue to tune in to GP Notebook TV for further videos. Thank you.